Prime objective of the World Health Organization is the fight against disease on a global scale.
We started giving all three drugs together, and to our astonishment, by being meticulous, we found we weren't getting any failures. Nobody believed us.
On this World Tuberculosis Day, let us reaffirm our commitment to tackle this deadly disease together.
You can't control tuberculosis if you don't control tobacco use.
This is a moment for us all to collectively step up our commitment to ending TB.
It has been an insightful and inspiring 4 days at the 52nd Union World Conference on Lung Health. As we draw to a close, we would like to honor extraordinary work with the prestigious Princess Chichibu Memorial TB Global Award and the Stephen Lawn Award. This year, the awards go to exceptional individuals who give us hope for the future of lung health for all.
The Princess Chichibu Memorial TB Global Award. This award has been given every year at the World Conference on Lung Health since 1998 by the Japan Anti-Tuberculosis Association in collaboration with the Union. The late Princess Chichibu had been patroness of the Japan Anti-Tuberculosis Association from its foundation in 1939. This award was initiated based on her wish to make the world free from tuberculosis. The winner of this award for 2021 is Professor Knut Lundot. Now, Her Imperial Highness Crown Princess Akishino, the patroness of the Japan Anti-Tuberculosis Association, presents the award.
It is a great pleasure for me to present the Princess Chichibu Memorial TB Global Award. I would like to thank the Union for its long-term collaboration with the Japan Anti-Tuberculosis Association. Professor Knut Lundot, the winner of this year's award, led for 14 years the development at the World Health Organization of key global policies for tuberculosis based on social medicine and is currently engaged in research and education at the Karolinska Institute. He has published many scientific research papers on social medicine. He examines how social and economic conditions interact with health and its disease in various communities and explores ways to alleviate people's suffering. His work has helped to foster policies and strategies to improve the health systems of many countries and to reduce tuberculosis around the world. He has contributed to the development of the End TB strategy and to putting it into practice. I would like to express my deepest respect for these outstanding accomplishments. The current COVID-19 pandemic is a difficult challenge for all of us, but I sincerely wish for your good health and continued contributions to promoting global health, including measures against tuberculosis for vulnerable people and mentoring junior researchers and policymakers worldwide. On behalf of Japan Anti-Tuberculosis Association and the Union, I would like to offer the Princess Chichibu Memorial TB Global Award for 2021 to Professor Knut Lonlot for his outstanding contributions to TB prevention and his efforts towards ending TB. Congratulations.
Thank you very much, Your Imperial Highness Crown Princess Akishino. Thank you also the Board of Directors of JATA and the Union for giving me the great honor of receiving the Princess Chichibu Award this year. I'm very humbled by the recognition of my small contribution to the global fight against TB. Indeed, what I'm being awarded for is the result of immense teamwork with colleagues in the World Health Organization, national TB programs, other national and international partner organizations, and of course, academia around the world. Thank you also to all of you, and I'm looking forward to the continuation. I will myself, to the best of my ability, continue to contribute through research and teaching at the Department of Global Public Health at Karolinska Institute and its Center for TB Research, the newly established WHO Collaboration Center on TB and Social Medicine, and the Sparks Network. Thank you again. Arigato.
Hello, my name is Professor Joy Lawn, and I'm here to tell you about my husband, Steve Lawn, a clinician scientist who worked on TB and HIV around Africa, productive communicator, published more than 270 papers. He was deeply caring. He cared about every person he came in touch with equally, and deeply cared about the injustice of TB and HIV, often for the poorest families around the world. But he also cared about next generation researchers and building them, investing in them. And so when he died in 2016 of a brain tumor, we set up a prize in his name, the TB HIV Research Leadership Prize. Now, many prizes go to senior people. This prize is deliberately for future leaders, those who are undertaking innovative research with a focus on impact in sub-Saharan Africa and on TB and HIV. The prize gives a certificate, a check, a profile in Lancet, which is meant to give you a leg up in your career, fellowship to attend the Union Conference, and the opportunity to attend the next Stephen Lawn Memorial Lecture, unfortunately not in a pandemic though. This prize is only possible because of partnership, which Steve stood for very much all his life. The prize is led by the Union. Thank you. And particular salute to Tony Harris, a hero to many. With the TB Centre of the London School of Hygiene and Tropical Medicine, the dynamic co-directors there of Toyin and Finn. Thank you. And at the University of Cape Town, the Desmond Tutu HIV Centre, with the world-changing, inspiring Linda Gale Becker. Thank you. And last but not least, the Lancet, with particular gratitude to Richard Horton and to Jenna, who runs the profile group there. And so, over the few years that this has been running, 4 fabulous prize winners have been awarded. And I would now like to congratulate the 2021 prize winner and 5th awardee of the Stephen Lawn TB/HIV Research Leadership Prize, Dr. Alberto Garcia Bastero, clinician scientist at ISG Barcelona. He's got 2 MScs, one from the London School of Hygiene and Tropical Medicine and one from Barcelona. And his PhD is from Amsterdam. Now, when I look at him and I look at his CV, I see a clinician scientist, a communicator, a productive one. I see somebody who cares and cares deeply, especially about his colleagues and the community in Mozambique, where he's done a lot of work. And special to me is the fact that he met Steve on Steve's last trip, just a couple of months before he died, to Amsterdam for a PhD defense of one of his mentees. And so, Alberto, I congratulate you, and I also pass to you the baton of Steve. Thank you for all that you do, and may you go from strength to strength throughout your career. And to Alberto, the previous prize winners, and to each of us today, may we also take up this baton. May we be, yes, clever scientists, yes, good communicators. May we care deeply. Each of these preventable deaths from TB and HIV around the world is more than just a number. And in these days of the pandemic and collateral damage to services, may we have courage. Thank you.
Dear colleagues, I hope you're having a great union conference. First, allow me to thank the London School of Hygiene and Tropical Medicine, the UCT Desmond Tutu HIV Center, and the Union Against Tuberculosis and Lung Disease for awarding us with the Stephen Long TB and HIV Research Leadership Prize. It's a great honor that these renowned institutions have selected us for this prestigious award. Allow me also to thank my team at the Manisa Health Research Center and those colleagues at the Barcelona Institute for Global Health, with whom we have established a stable platform to do TB and HIV-associated TB research. I need to acknowledge that this prize has a special meaning to me because it honors the memory of Professor Stephen Long, who is one of my top research heroes, a research idol. He has done groundbreaking research in the field of clinical epidemiology, in the field of TB diagnostics and HIV-associated TB, and I still today read his papers frequently, and I think it's undeniable that his work has truly inspired my career. I had the chance to meet him once. It was at the PhD defense of Dr. Andrew Kerkhoff in Amsterdam, a few months before he passed away. We had dinner together, and although he did not speak about TB or HIV, he gave us a truly inspirational masterclass on how to be a better researcher. He spoke about how we academics often forget about the true essence of research and how we sometimes pay more attention to some superfluous, sometimes ego-driven aspects of research, which is very wrong. He stressed the importance of promoting the good values of research, of the importance of collaborating amongst us, of helping each other, of building capacity to be more and to be better. So Stephen's legacy and his values is something that will remain amongst us for many years, and receiving this award with his name is something that I will always be grateful for. So thank you very much.
Honoured guests, distinguished members of the Union, conference participants, thank you for your participation in the 52nd Union World Conference on Lung Health. I want to begin by offering my congratulations to Alberto Garcia Bastero, winner of the Stephen Lawn Award for Research on TB-HIV, and Knut Lönnroth, winner of the Princess Chichibu Memorial Global TB Award. What an incredible 4 days we have had. I'm always inspired by the commitment, enthusiasm, and resilience of the tuberculosis and lung health community. As ever, the Union World Conference is a true reflection of these characteristics. I've had the good fortune to watch and participate in fascinating sessions which have affirmed my belief that we can achieve a healthier world for all, free of tuberculosis and lung disease. I want to thank all those people who have made this conference not only possible, but an outstanding success. The close collaboration between teams of members and staff led by Dr. Kari Tudor, the chair of the Coordinating Committee of Scientific Activities, and David Jackson, the director of conferences, underpins this successful outcome. I know everyone is looking forward to meeting in person and starting to get tired of this virtual world. But we must continue to do what is necessary to collaborate, share, and act. I am proud that the Union World Conference has been able to adapt and remain the platform for this in the new world. Your continued support of the Union remains an integral part of this. I would like to thank you all personally for your unwavering commitment to end tuberculosis and lung disease. Of course, this mission has become more challenging because of the COVID-19 pandemic and other recent difficulties the Union has faced. However, the challenges are nothing new to an organisation established over 100 years ago, and we will overcome them together, as we have before. I only have to look at the incredible achievements of our Union colleagues in Myanmar, working in such turbulent circumstances, to put our own difficulties into perspective and remind me of what is possible. Such examples of fierce commitment in the face of adversity are exactly why the Union continues to strive to end suffering due to tuberculosis and lung disease by advancing better prevention and care. We seek to achieve this by the generation, dissemination, and implementation of knowledge into policy and practice. We aim to ensure that no one is left behind, people are treated equally, and we have a focus on vulnerable and marginalised populations and communities. The theme of this year's conference encapsulated it so well: Lung Health for All, Solutions for a New Era. As the Union steps into its second century, we must remind ourselves of our vision for a healthier world for all, free of tuberculosis and lung disease. In the years to come, we are looking to engage youth in the fight to prevent and end suffering from lung diseases. We recognise the energy and innovation young people bring to the table, and they are crucial to ensure a promising future and a healthier world for all. Thank you for your attendance at this 52nd Union World Conference on Lung Health. I wish you a healthy and successful year ahead.
Congratulations to the winners of the prestigious awards. We are grateful to all our distinguished guests who have graced us with their presence and patronage towards the 52nd Union World Conference on Lung Health. Thank you once again, and we look forward to seeing you all next year.